This was our section on the synchronicity of innovation and healthcare, and we have some really great questions from the audience today as well. So all of these areas of development have been really, really interesting, and you're bringing solutions to those who need it most. So it's really increasingly clear that this is a global, this is a global issue. And it comes to exactly the same point that we cannot be working in silos, be they country silos or industry silos. We really must be looking at ways that we can collaborate and we can bring the data together and bring our learnings together as well. So with that in mind, it's going to be, I'm going to kick off our Q&A session. So can I ask all of our speakers from this section to put your cameras on? And I have a couple of questions. Actually, there's quite a few questions, Tal, from people in the audience who are interested in hearing a little bit more about your hub. And also, I'd really like to hear from you. What are you looking for in terms of new FemTech startups to apply to your hub?
First of all, if you're interested about my hub, come to Israel. That's the first thing you need to do. By the way, Israel from Sunday is doing third vaccine. So should be safe here. We don't wait for anyone, you know. I mean,
actually, I'm only 1 hour away, I think.
Even better. So, I mean, maybe the fact that the CEO of Pfizer is Jewish helps us. But anyway, I think we bought everything they have and we can sell you guys. But first of all, you need to be here. What I'm looking for, I will tell you, maybe that will be a kind of a downer. I don't look for the technology, I look for the people. I know if I get the right people, oh my God, they can innovate endlessly. I need people that are willing to take risks, because this is what our ecosystem is about. Not just in Israel, the fact that here everything is kind of a sense of urgency. So if we all believe FemTech needs to fly, we need to work faster. I mean, sleep less, work more, you know, all the phrases. Here we do it. I think there is a very vibrant ecosystem that can support. I mean, some countries, you speak startups, they say for them, startup or a homeless person in the corner of is the same, not in Israel. In Israel, you must have a startup. So everything is supported. All the hospitals in Israel, all the HMOs have innovation officers. They all have hubs. They all have accelerators. Wherever you turn left and right, you want a better side, they fight on you. So everything here is kind of, in my eyes, from my experience, is ready. And so are investors. And you saw it in the research that Kate shared with us. I mean, Israel, 9 million people. US, 304 or 400 something million. And we are in the same slide. Just understand what's going on here. Singapore probably should have been there. Someone kicked them. I don't know what happened. But you're there also. I mean, everyone knows. The fact is, don't look for Israel. Look for this ecosystem. This is where everything happens. You don't need to move too much. Enough with the flying, COVID time. No need to move, digital. Just talk, get on a call. No need to you see my wife, you want to drink coffee? Have a coffee on your side, we can drink. Don't need to meet you, need to work. This is what we're offering here. This is what I'm offering, is to look at the hard pictures, not the chattering, the work. And if we come together and we can give our support to the startups, to you guys, if you want to have a shot, this is what I'm looking for. People. I hope it's clear enough.
Fantastic, Tal. I do think I hear that quite a lot, that investors are keen on the person really, rather than the tech specifically.
But still, I want to note that from beginning of this conference, which was hours ago, I was jumping from another conference in Washington, like virtual, on biometrics, and spoke about FemTech. I got one invitation on LinkedIn. So either I was that boring or intimidating or too aggressive. This is who I am. I can handle the one invite. I already answered. What are you waiting for? This is what I'm speaking about. Wake up, without the word I want to say in the middle. Wake up. and get moving. No one will do this for you. No one. If you're expecting here someone to reach out and write a check, forget about it. Ain't gonna happen. It's about you. And if you want to reach out, and the way to reach out is to connect, is to speak, parler, speak. Don't let us guess. That was my spiel. Thank you.
Fantastic. And Nicholas, I've got the same question for you. So Tal is looking for the person. Are you looking for anything specific in your accelerator that the audience members can think about or potentially pitch to you?
Yeah, no, we are pretty open on this. Openness and open innovation is our keyword. So we are not, as I said before, we are not taking equity in any startups. We are here for growing the FemTech domains. The EPFL is a public school, so it's a public campus. So it's not making money out of this. We are international. There most of the nationalities on the campus. So we are definitely looking for startups. We are looking for collaborations on the global scale, co-developments, and also more tactically trying to enter into the Swiss ecosystem of health. That's the key thing. So yeah, that's mostly our purpose.
Brilliant. Thank you so much. So I've got a couple of questions for you guys. Karen and Simona specifically, I'm going to target this one to you two. You both mentioned creating solutions for rural and marginalized communities. Quite often these communities are neglected in the femtech industry. A lot of the innovation happens in the West, mostly by cis white women, so who often create for themselves, right? So what can we do as an industry to ensure that more marginalized and rural groups are being considered in the innovation pipeline? Dr. Simona, do you want to go first, and then we'll go to Karen?
Okay, thanks for this question. Sure, I think that one point is to consider problems that are also spread in developing countries. Women live in developed and in developing countries, so the same problems, health problems, are worldwide. If we have to think about solutions to bring to the market, sure. So generally speaking, the solutions are for developed countries. But if we are thinking about solutions good enough to reach also the developing countries, this could be a good choice, I think. So first point, think about problems that are worldwide. And second point, the solution could be a good solution from a technology point of view, from a price point, good enough for for developed countries and developing ones. Sometimes it's not possible, sometimes it's possible. And from my point of view, and iron deficiency is one of these cases, it's amazing to think about solution good for women worldwide.
You're absolutely right. I mean, the same conditions affect everyone, right? So it shouldn't be so siloed. Karen, I'd love to hear from you.
What was the question again? Sorry.
Sorry. So what can we do to ensure that there is sufficient innovation that's servicing marginalized and rural communities? Because so much of this innovation and the funding is happening in white Western countries, basically. So what can we do in order to ensure that we are being thoughtful about people all over the world and not just those in the countries where the innovation's happening?
Well, I think firstly, it's super difficult. Secondly, I think it's one of those situations where you actually have to go there and speak to people and do really basic things that don't require tech or any sort of like premium innovation. I don't know how to say it, but I mean, what are they really struggling with? Babies are dying, mothers are dying, kids are not going to school, girls are being put out in outhouses because they're bleeding. I think maybe when we talk about not the lowest level of underdeveloped countries, but emerging markets, like femtech in emerging markets, what does that look like? My husband's from Brazil. We go to Brazil, is an emerging market, like 30%, like a third of the country doesn't have a bank account. Everybody owns a smartphone. It could be something as simple as setting up chats with women groups, like having ambassadors of your brand, of your product, go from house to house to teach women, who then teach other women in their circle. We also do a bit of business in Angola because it's Portuguese speaking as well. And they are one of, I think, maybe the third highest infant mortality rate. And they are just struggling to look for something that will stop their mothers and babies from dying. And sometimes maybe the only way to do that is to physically send a doctor down, you know? They're not looking for, and this isn't to say that all the other companies in the West, like, they don't make sense. It's just, it's so far removed from what the reality is in some of the countries that it just, sometimes you don't even need that kind of first level of innovation. You just need to reach out to the people.
Absolutely, and that puts us straight back into the patient-centered design argument and the argument about having people who are genuinely affected by these issues in the room, who are in the innovation room, who are in the funding room, and deciding where, you know, the money goes, what we're going to create. And it just comes to that diversity of of people in the right room. And Daniela, you've been very thoroughly nodding to this. Do you have some comments about how Ocon's going to deal with this?
I can tell you from our experience, we just went through a major shift in Ocon. We actually changed out our management, half of our board and our team. We were mainly men. The board was majorly men. The team was men. We had a male CEO. And about 2 years ago, we changed it totally around. We're now 85% women. And also our board consists of amazing women and also investors. We have Raya Ventures, who was also mentioned earlier in the statistics, who are mainly women investing in women. And here it also comes back, I have to, nod to what Tal was saying. It's about the people in the company understanding the issues they are developing innovations for. It's a totally different conversation. And also it's about impact. On the one hand, we're all trying to create impact also for the developing world, which we are also trying to do with our impact investors together, that are funded by big organizations like the Bill and Melinda Gates Foundation. But, you know, when you see the impact you can have on one woman or 2 or 3 women in our phase 2 studies, we had women, 13 women come in with an immense score of heavy menstruation. These had a score of 6 times the menstruation of a normal woman who is menstruating, meaning these women cannot go to work without an extra set of clothes. These women are dripping blood in the shower, throughout the day. This is a major loss of quality of life. And us women, we understand what that means, for our jobs, for our careers, for our, private life, free time. So seeing these women after once and done treatment of our product actually being reduced to what's a third of a normal menstruation, with a non-invasive treatment, that's something where everyone in the team is just, excited about. And that's where we know who we're working for, who we're all doing this for. As a startup, you're putting in a lot of work, you're putting in long hours, but this is actually what you work for. And I think this is the passion that those teams, and also diverse teams, need to have, and the companies need to have. I 100% agree.
What a breath of fresh air. Yeah, so often there are the wrong people in the rooms, and there's innovation for innovation's sake. So actually I want to build on that and ask, this section is about synchronicity between innovation and healthcare. So how is Ocon, or do you have plans for Ocon in ways to integrate and synchronize with consumer services, commercial services? Are there opportunities for collaboration and integration there too?
Definitely. I mean, partnerships are the most important. We are, on the one hand, we want to create, an environment where our product is accessible by the majority of women of all different societies and colors. So this is something where we're working hard on. It's completely different landscapes in Europe as opposed to the US. So we're now trying to find partnerships where we can bring our innovation also to the US. And in terms of our consumers are, the women, but we need healthcare professionals to actually use the product and insert the product. So it's not a direct to consumer product, but we are working with foundations that help us also get to the consumers and educate and make sure they know that these treatment options are available. So this is super important, and we are open to any partnerships and collaborations, also with Big Pharma. We have an amazing platform at our hands, and we can deliver any drug or substance to the uterus. So we are also talking with the big companies to see how can we collaborate to create more solutions for consumers to just make women's lives better.
Such a breath of fresh air. Thank you so much on behalf of all of us. We're very, very grateful. And Nicholas, I've got a question for you as well, as this is all about collaboration and the integration of innovation in healthcare. Can you see or foresee some interesting opportunities for the wellness sector and other consumer-facing products to collaborate with healthcare and with the clinical side?
Yeah, the question is not easy to answer. We have a focus group dedicated to this. So it means that not only one brain can answer this question. In this focus group, we treat about wellness and prevention. It's not by chance, it's coming together. So the focus groups, and I really would like you, all the community, to join this focus group and to join the conversations for co-developing, for thinking, for networking on these topics, and to address this kind of questions. How can we break the walls between wellness and clinical studies, all these kind of things that must be addressed with specialists, with vendors, with large pharma, with medtech companies, with hospitals, with pain point owners or holders, people who are bringing the real problems on the tables that can be addressed with the solution providers. So yeah, thank you for talking about this, Anna. I think the best is really to join these focus groups, and I can share the program of the next focus groups. Everything is online on Zoom, so it's pretty easy to join. You will meet with people from all over the world, and most of them are specialists of the specific domain. So if we talk about menopause, it's going to be on menopause. On wellness and prevention, it's a little bit larger, but it's specializing.
Fantastic. Yeah, I can't wait. And it seems like a really sensible solution as well to ensure that you're delivering services and solutions that are genuinely going to help people. If you're crowdsourcing all of this information and all of this feedback, that seems to me like a really sensible solution to innovation, and making sure that we're giving people the devices and the services that they need. So that sounds really smart. Actually, do you know if any other accelerators or investment firms are doing something similar? Because I've not heard of that yet, and it sounds like a really sensible solution.
Yeah, not really in the same. There are some FemTech accelerators, and we try to collaborate with them. They have some different positioning, and even the one in Singapore or in Tokyo, the Fermata is more on the how can I say that, on the consumer side of the FemTech definition, while we are at Tech Forever more on the science, coming from the APFL background, of course, science and innovation, but some others are focusing more on the promotion of women as leaders. So there is Women of Wearable, for instance, in London, which is doing a great job, which has a positioning which is very different from Tech Forever. And there are some accelerators specifically for corporates as well. I have one in mind, Israel, which is founded by AXA, insurance company. So they have different approach, and it's good like this. I think different definitions of FemTech, and yeah, we need to be complementary.
Fantastic. And Karen, this one's for you. So what are the big trends happening currently in Southeast Asia that we could all be looking out for, and that you think we should be kind of adopting or paying attention to in the EU and the US?
Oh my God. I feel like we actually are following the EU and the US. Wow, I have to think about this one.
Sorry, I've put you on the spot there.
Yeah, I mean, I honestly, I was just looking at what was new in Singapore, but it seems like they all exist in the US and Europe. So recently we have more personalized supplements, which I'm sure came from the US. We do home hormonal testing. We just had our first menopause sort of community app, which is big in the UK. So I don't know yet right now if anything goes the other side. What is common in Southeast Asia is the making of reusable menstrual pads by women in rural communities. So they employ women in the village to do that and then give them jobs, which, I don't know if that would ever make it to the West in that sense, but that helps in Southeast Asia. Perhaps, yeah. And I don't know, to be honest.
And I think that probably comes to as well the comment that you made just at the end of your talk, which was that quite often there are innovations that are being created for the investor really rather than for the consumer. And so perhaps it's an issue of not having the investors and the accelerators that are willing to really take those risks, and are just kind of going for the safe options by looking at what's already being successful in the EU and the US.
I think, sorry, just to add on before I forget, I think it was only last week that the national newspaper featured 7 femtech companies for the first time, and identified them as sort of investment categories. I think Nicholas would know about this. He works pretty closely with Fermata Japan and Singapore. So actually Fermata Japan going into Singapore was a pretty big deal. I think it was something where they saw that the industry could grow in the Southeast Asia region, because I mean, Fermata Japan works with regulators. They change regulations in the Japanese government, so they're big in Asia.
Yeah, that's a really interesting opportunity, and it shows that FemTech is now becoming a buzzword there too, which is really important, and that's basically what we need to see. But yeah, maybe there's some opportunities there to create some more
For sure.
Southeast Asian focused solutions and businesses for that market.
Yeah,
So
I mean, we have TCM patches, TCM menstrual patches, and TCM supplements. If you believe in the power of alternative Chinese medicine.
I don't know what that means. What are TCM patches?
Traditional Chinese medicine,
Okay.
where you get PMS. So they have patches. We have like
Amazing.
little drinks, supplements, herbs. So that might be something.
Anna, can I suggest something? It seems that we are all so happy here about ourselves. We can really sum up and say it was amazing, we're the best, but we're not, okay? So please, let's tune it down back to reality. How about, because Kate is here, and Kate seems to be looking for what else can we do here? And I think that if we will have a panel where we're sitting on the panel and letting the startups or the entrepreneurs or the ones who want to have a shot tell us, share with us the difficulties, the hardships, what's not going right for them. It will be super productive, one. Second, there is a big gap between what startups think how to engage with industry to what the industry expects and can handle when startups approach them. For instance, a startup has no problem telling to the CISO or the IT admin, listen, I just need your database, like it's nothing, just give me your database. It doesn't work this way. There are gaps even in the understanding of the engagement between startups and corporates. So I think that if we want to dive in not too deep, and again, in way of value, like this time, I think there is a way, first of all, to open it for the startups, for the audience, to say what they want. And I think we can cater and service it. I think it will be amazing since we are from all different location, territory, geographically. I think there is a lot in common still because it's a business of people and we're all the same. But we need to not all the time tell them. I think we need to not just read what they write, but let them speak. And I want to say, count me in if you do that. If you don't do that, I will do that. So I'm just offering here in a way of cooperation. Let's do it together. And I think they really need it. They need to sound their voice a little bit, not just to type. So this is just from me.
Absolutely. Thank you very much for this comments, Tal. Again, we produced our first open access analytical report, and I've mentioned that we are soliciting feedback. And I know there were also some questions from the audience as to what does it take to be featured in a database, let's say, for the company. So, database is open access. We welcome the feedback. And also, if someone believes that the company or, influencer or investor, etc., or accelerator should be featured there, as long as they qualify and we have a rather wide definition of FemTech, we are, eager to feature everyone and again, continue with future reports, either in landscape shape or at a certain angle, as well as continue with our online free conferences on a regular basis.
Clear. I'm just saying, if we wait for the audience, we can tell them, guys, you want this again? Make it happen. It will never happen. Okay, they will still be looking at us or at you and saying, okay, can you please help us? And this is the strong, they need an adult in the room to get things sorted out and then only engage. Once you let them have the floor, I think it will be an amazing event. Also, this recording is amazing. And again, the opportunity that you're giving should not be taken lightly. It doesn't happen to this fortune doesn't fall to your lap every day. That's what I want to say. Aside from the fact I'm here, of course, which is look at that. Oh my God. No, Nicolas also.
Yes,
Nicolas, we're connected on LinkedIn, but we're not talking. I don't know why.
We are connected from today, no, or connected a few days only, no, or
few days. Yeah, when I send you the invite and you generously accept it. You see?
We will definitely.
But I'm the older between us, but we should go to a private room now.
we will talk then.
Tal, I think you're absolutely right. We need to be creating more of a two-way dialogue in this field, and we could certainly be taking more of a note from Nicholas and from Tech Forever for creating these opportunities and these ecosystems where people can share their opinions and their feedback. So with that, I want to thank everyone. Thank you, Nicholas, Simona, Daniela, Karen, Tal. It has been a really, really fantastic evening, morning, late night, wherever you are. Have you got any closing remarks? If there's anything you'd just like to leave the audience with now, please do just jump on. Fantastic. All right. Thank you so much. We've had such an amazing and exciting mix of innovators and creators and market leaders and investors today. And I've honestly learned so much. My brain is absolutely buzzing with new ideas and new ways that this industry is going to develop in a really healthy and solution-driven way. So thank you so much, everyone. Certainly the biggest things that I've taken away from today is that FemTech is not immune to the traditional problems of innovation silos. So as we've all been talking about just now, we need to collaborate, we need to co-create, we need to connect. The only way that we can deliver solutions needed is by putting a greater range of faces and voices in the positions of leadership and influence. So I'm really looking forward to seeing more people in these positions and reaching out to marginalized communities as well. I think that's going to be so important. Let's really take this as an opportunity as well, just to put the patient, or as we mentioned earlier, the person at the center of our innovation and our healthcare issues. You know, we can't create these solutions top down. They have to come from those who need it. So I think we've heard that time and time again today as well, that a lot of these businesses and a lot of your innovations are coming from the people. So it's really encouraging to hear, and we need to keep that going, basically. This has been a really fantastic analysis of the FemTech landscape today. As I mentioned before, I'm the co-founder of Ultraviolet Futures, and we just launched our very first trend forecasting report in FemTech. It's called the Future of Cycle Care 2022. So if you were really interested in how the landscape looks today and you'd like to learn more about where we think it's heading in the future, my co-founder has actually just dropped the link in the chat, so you can click the link, or you can email me at anna@ultraviolet.agency if you'd like me to send it to you. And that's where we really look at forecasts for the industry rather than the insights that we've been analysing today. And as Kate mentioned, you can also access the FemTech Analytics report at femtech.health as well, which is open access and interactive. So there's so much data and so much information that you can be accessing today. And if you do have any questions, we will be sharing the recording of this event with everyone who attended and everyone who was unable to attend today. We'll also have links to all the information about all the speakers and myself. So we can all continue to have this conversation, because I think really what we've all come away with is this is just the beginning, and there's still so much that we need to do in order to bring this industry forward and to continue to innovate. So thank you so much, everyone. This has been really fantastic. Thank you, FemTech Analytics, for having me and for allowing me to moderate today. I've had a blast. I hope you all have as well. And hopefully we'll see you at some more of these in the future, and some more opportunities to collaborate as well. So thank you.
Thank you very much, Anna, and all the panelists and speakers and the audience.
Thank you.
And good luck for the baby.
I'm gonna need it, guys. Thank you.
Very much.